Kent County health organizations are using a new study to help improve medical care. They conducted 12 focus groups with 120 people and did hundreds of interviews to find out what people in Kent County are concerned with when it comes to health care. And based on that information, they came up with 5 priorities. They are to increase the number of people who have affordable health care, to increase the number of providers who accept Medicaid or offer free or low-cost services, reduce disparities in prenatal care, ensure access to healthy food, and reduce disparity in health risk factors and protective factors between students. Cathy Raevsky is the Administrative Health Officer for Kent County Health Department. We appreciate you joining us.
Thank you.
That is a wide range of different things, categories.
It is.
Why do this study and this questionnaire in the first place?
Well, the reason that the questionnaire was done was to find out what the people of this community think they need and they want, not what the provider population thinks the community needs, and to try to bring those two differing opinions together.
Did you have information or feedback before in the past that showed that maybe there were some gaps on how you could improve and decided to go about it this way?
There were several things. For when we had done surveys in the past where what the community said they thought was important, it wasn't showing up on the radar, the data, and vice versa. So there was a gap there.
How do you plan to approach tackling all of these categories? Those are some vast topics.
We have 5 different categories. We have a wide variety of community organizations and individuals who are involved, and they will gather around each of these 5 areas and develop the plans for each of these 5 areas. They can't take on the whole access to health care issue, but they'll take pieces of it that they think they can make a difference on and work on those.
So where are we right now in the process then? You've gotten the information back, you've identified the 5 categories that you want to tackle. Now what?
Now we go into the assessment phase where we find out what's happening in our community around these issues, who's working on it, what are they doing. When we've done that, then we will look at evidence-based practices around those issues. The groups will come up with common goals, common objectives, common data sets that they're going to use, and that will eventually result in a community health improvement plan, which we'll spend the next several years implementing.
Okay, I was going to say, what's the timeline look like then? Because that's a lot of work.
It's a 3-year iterative process. So 3 years from now, we'll go back to the community and say, how are we doing? What do you think? Have your priorities changed? Do we need to look at this from a different angle? Or like I said, we can't tackle access to health care in one big bite. We have to take little bites out of it. So we'll ask the community, what do you want us to work on next?
You'll take this information, you'll apply some of it, you'll reassess later with another, go back to the community, another questionnaire.
Absolutely.
Was there a big eye-opener for you from this particular questionnaire that came back?
I think that there were several. One, probably because I don't have teenage children, was that kids will wear their seatbelts in a car, but they aren't going to wear bicycle helmets, typically.
Okay.
Which seems odd to me, but not to most mothers of teenage kids. And the other thing is about dental accessibility, that the city of Grand Rapids can only have enough providers to cover about 55% of the dental needs in some of our at-risk populations.
So you'll be able to zero in on some of those things and improve others.
Hope so.
Cathy Raevsky, thank you so much for talking about this study. If you'd like to look at it further, of course, we have access to that probably on our website, the Kent County Health Department. Cathy, thanks for joining us.
Thank you.